Thank you, Aiste. Um, you can see my screen, right? So first of all, let me say that it is a big honor for me to thank you for the invitation to step in here for Marcus, who was initially thought to give this presentation today for you. So there's no doubt that I cannot replace him, but I will do my best to supplement and give this presentation in behalf of him. So again, my name is Frank Siebenhaar. I have been working together with Marcus for the last 25 years, and I'm now heading our outpatient clinic here at the Institute of Allergology at Charité, and it's my great pleasure to be here with you in this webinar. Also, thank you, Kristen and Victor, because you perfectly set the stage. And I'm not talking about the other side, because, especially talking about patient charter, we first need to, identify goals before we can achieve them. And even the word shape decision making makes clear that we can only do this together in a partnership between patients and physicians. And how we can facilitate that partnership. This is the topic of this presentation, because since urticaria always seems to be an easy disease when we look to our textbooks, because there's only two clinical signs, there's real and there's angioedema, but we clearly know that it's not an easy disease. Why? We have these different forms. There's chronic spontaneous urticaria, which there's no identified trigger. So patients cannot come to the doctor and say, I know why my wheals come or when my angioedema will appear. Sometimes it is possible when it comes to chronic inducible urticaria. So there is triggers. There's one easy question you can ask yourself: can I make my wheals come? So in cold urticaria, it will be the case if you come in contact to cold, or in heat urticaria in contact to sunlight, or any type of warm. Also, there's a lot on the disease we do not see, which is not obvious to us as physicians, because, having wheals, having itch, having angioedema, we know as experts that this impairs with your sleeping, with your emotional well-being, with your daily activities, with your professional activities. And now comes the problem: there's no blood test we can do that tell us how bad your symptoms are or how well controlled your disease is. And then what you hate probably most, and even more than we, is if you come to see your doctor, there's no symptoms you can show. Sometimes that may even feel embarrassing for patients, because they may even believe, or you may even believe, that your doctor doesn't believe you, how severely you are affected by the disease. But there are some things that you can do, even in preparation of the appointment to your doctor. So many of you may know, and if not, please let us know. We will send to you that there's urticaria calendars, that there's tools like the Urticaria Activity Score, which by 2 easy questions a day: how severe is your itch and how many wheals you developed over the day, will give an immediate impression how severe urticaria has been over the last weeks or months, without the need of showing this to your doctor. Also, if you have wheals, if you have angioedema, remember to take pictures of your skin lesions and of your face or your hands or your feet, whatever is swollen. This will give you confidence in saying, look, my doctor, this is how I looked like yesterday or a week ago. And for your doctor, it's even more easy to identify, yes, this is wheals, this is angioedema, because if we see them on a picture, basically, it's a one look, and we are sure we're talking about chronic spontaneous urticaria or angioedema. Also, if you have identified possible triggers, write them down, bring them with to your appointment. I think, every time I'm doing this or that, my wheals start to come, or my wheals get worse, or my urticaria activity gets worse. Also, because sometimes this is of big interest, Write down your medication plan, if you take any medications on a daily basis, and the medical history, what has been happened to you on a medical side before. Have you been operated? Is there any other known diseases, chronic diseases you are suffering from, or for which you received treatment in the past? And write down your questions. Kristen has also said this, because at the moment you sit in front of your doctor, believe me, you will not remember them. So please write them down, bring the sheet with you, and go through the questions. And you can even collect them, a while before, and you will be sure that everything is being touched upon in the conversation to your doctor. And what is very helpful for you and for us as physicians in the way we talk about the disease is the use of specific questionnaires. We also call them patient-reported outcome measures, or short, PROMs. What are PROMs? PROMs capture different aspects of a disease. For example, measuring the symptom burden of chronic urticaria, or measuring the impairment of your life quality and also your overall health status. There's tools for urticaria and angioedema that has been validated in the past. They measure what they are supposed to measure, and they give a good impression how severe your disease is, how impaired your quality of life is, and what other aspects of the disease are important for you as being the one affected by the disease. Also, if you file them on a regular basis, they also help us to measure how good or how bad the treatment is we give to you. Is there a need for improvement, or are we on a good track? Of course, you can also tell us, but by measuring these tools gives even a more detailed information for us as physicians, and we have something to talk about. You don't need to say, I feel good or better, or what means better. Put it down on a sheet of paper, put it down in these validated questionnaires. We translate this in numbers, and we both have the same page to talk about. So as said, there's various prompts about various aspects of chronic urticaria and chronic inducible urticaria. They are not on that screen available so far. And I said they measure disease activity, and there's two different tools, one for urticaria, the wheels, a specific one for also angioedema, the AAS, the angioedema activity score. The other one is the urticaria activity score, both easy. And let us know if we could make these tools available to you. Two different disease-specific quality of life questionnaires for chronic urticaria and for angioedema, and also so-called control tests. So what means disease control? Disease control means, as you know, to our guideline and to the goals we want to achieve together, we want you, or we want us, to control your disease completely. No wheels, normal quality of life. And to achieve this, we also need tools to measure this in the class. And this is not only important in the daily practice, this is also important in clinical trials. And the UCT, the Urticaria Control Test, is a very easy tool. The angioedema tool is also easy, a bit more complicated, but the Urticaria Control Test only has 4 questions. So you can file them in the waiting room of your doctor's office, takes you a minute. And by answering these questions on, how severe have your symptoms in the past 4 weeks? How do you feel your quality of life was affected? How good was your treatment over the last 4 weeks? And how did you feel your disease was under control? And by putting these 4 easy answers, there's a score, and the maximum score could be 16. That would be complete response, complete control. There's a cutoff, which is at 12 points, at which we say everything which is higher than 12 is okay, maybe negotiable. If you go along with having maybe symptoms every second week a little bit, and do we want to improve the treatment option if we can, or is this a situation for you you can live with at the moment, hoping that it will improve in future? But if it's below 12, that's a clear sign we need to work further together to get your disease under better control. And also these tools are being used in clinical trials. And this is not something we ask you, just to inform you that clinical trials is that tool and the option for you to get in contact and have access to the most modern and to the most hopeful treatment options that are available. And you know that these clinical trials run in different phases. So if you come to our center, for example, and we propose a clinical trial for you, why? Because everything which is on the market doesn't help. It's 20% of patients in which even omalizumab anti-IgE doesn't help, doesn't lead to the full control of disease. So you will not be the first person on this planet receiving this drug. I must say, or we must say, in most circumstances, there's drugs already on the market, but for other diseases. So they are already proven to be safe. They are already proven to help patients with other diseases, for example, atopic dermatitis or chronic pruritus, for example, dupilumab is on the market for years, and it helps also chronic urticaria. We know that. But to make it available, to make it market access, and also to have payers, your health insurance, being able to reimburse that treatment for your disease, for chronic urticaria, it needs these clinical trials to give proof, scientific proof, that this is a good treatment for chronic urticaria. And in most cases, it will be a so-called phase 2 or a phase 3 study, which are basically confirmatory. So drug has been proven to be safe already. Drug has been proven to help people with other diseases in many cases. And here now comes, we want to give you a good treatment option, which is better than the ones available. And you can even help us in bringing these treatment options to even a higher number of patients, because once a drug is on the market, every urticaria patient can benefit from it. And last but not least, and this I already transmit to the next presentation, there's a digital tool available which will help to make shared decision making, and also has all the tools and questionnaires in it that are just recommended to you and introduced to you. And I'm not want to go over you, Aiste, but I can promise that Sophia will introduce this app, Cruise app, in the next presentation. Thank you for your attention.
Thank you so much, Frank, for your great presentation, and we'll delve into the cruise right away. And before we do that, I have one just tiny little notice. I love that you put the clinical trials as a tool, because we do sometimes face a lot of different opinions about it, and it's not always seen as a possibility. It's not always taken in a positive way. So this is, I just want to put a highlight on it, that this is actually a great tool that might be useful for the patients that do not find relief with the medication that are already available on the market. And you see on a daily basis the most difficult urticaria cases, the most resistant to the treatment urticaria cases. I wonder, what is the biggest unmet need that you see when seeing these patients? What could you highlight? Because we are trying to highlight the education. We are trying to highlight the tools that we can give to the patients. But maybe you notice on a daily basis that this is not all, or this is not exactly something that we should be doing. So what is the insight on this point?
Yeah. See, Aiste, I think it's not a problem of what we do, because I think we are doing a lot. But what we may not do very well so far is making every patient aware that we are doing great things. You know, but maybe, I don't know if there's you know, an ideal way to go, because once before you start having chronic urticaria, of course, you don't deal with chronic urticaria. And I think one unmet need, and we can all think about how we can improve this, is to bring the information that's already there much quicker to patients that, you know, have their urticaria just a couple of weeks or a couple of months. and looking for information. So we should make sure that the information we make available for patients can reach them, that they find the right information. And not everything is right, what is written in the internet, unfortunately. So,
Unfortunately.
there's a lot of confusion sometimes. Patients still think, urticaria is a dangerous disease. For sure, it's not a dangerous disease. It's a very, impactful disease and a debilitating disease. So there's still, a bit of misconception and misinformation. We just need to be more and more visible with the good things we do.
That's true. And this is what we are also aiming to do with these webinars and the Global Urticaria Days. So I do believe that spreading the word will be the tool that we as physicians can use to bring the evidence-based information, to deliver them in the format that they are mostly fond of. And now maybe Cruz has some